Hello, I am Dr. Prateek Bhatnagar. I am the head of cardiac surgery at Omega Hospital, Gachibowli in Hyderabad. So, today I am going to talk about a very exciting thing, and for the first time in the world literature, we have done what is called, what actually I have called X graft coronary bypass surgery. So, X graft bypass surgery of the heart, which had never earlier been reported in the medical literature, has been done by us at Omega Hospital, Gachibowli, by a team that included, apart from me, Dr. Shubhi Bhatnagar and a big team of doctors and nurses. So, what is so special about this surgery? Now, as we know, bypass surgery is the commonest major operation done in the world, in the body. Bypass surgery provides the best long lasting benefits to any patient who is having blocks in the coronary arteries of his heart. Now, as you know, bypass surgery traditionally involves cutting the legs and taking the veins from the leg and using it for the bypass. In the last few years and decades, we have been using what is called BIMA, that is BIMA, bilateral internal memory arteries for bypass surgery, which provide the best long lasting benefits. Now, the new thing, that the first time that we have reported in the world literature now is X graft bypass surgery. Now, what is this X graft? X is a configuration in the form of the letter X that we form at the time of bypass surgery using the internal memory arteries, that is BIMA, from inside the chest or from the radial artery from the hand. So, we had this gentleman, 59 years male, and he is an obese gentleman, 100 kg is his body weight, and he is a diabetic and hypertensive, and he had already had spine surgery 2 times in the past. This gentleman developed blocks in the coronary arteries of his heart and was getting chest pain, that is angina, and for that he ended up with getting stents in his heart. Now, the stents unfortunately put in November 2025 blocked quite fast, and again he redeveloped angina. When the angiography was being repeated to see what the situation is, at the time of angiography he developed major rhythm disturbance problems in the heart called ventricular tachycardia, VT, and that needed multiple DC shocks to revive him. And after that he was transferred under my care from another place, and he was in a very critical condition. We had to keep him in ICU, stabilize him, and then we did his bypass surgery. So, his coronary arteries were arteries of the heart were in such a situation that he needed a different type of bypass surgery to get him back to his full health, and that is how we invented and came up with this X graft bypass surgery technique, where we use only arterial grafts, no cuts in the legs and no open heart surgery, no cuts on the heart, no stopping of the heart, and we were able to do the entire surgery. We gave him 4 bypasses using this X graft, and after the surgery he had a remarkable recovery. He was walking around within 24 hours of surgery and was discharged within 1 week. So, X graft bypass surgery started by me and my team at Omega Hospital, Gachibowli, is going to be a revolutionary surgical technique in heart's coronary bypass surgery. We are going to report it in the medical journals, and I am sure more and more cardiac surgeons from all over the world will pick it up and will use it for the benefit of patients all over the world.